Jesus, you're my reason. I love you every season. You're so amazing. Jesus, you're my reason. Your love has never failed. You shed your blood for me. Oh, Jesus, you're my reason.
Check what? Yeah, this is it.
Yeah.
Yes, man. I eat this. So we're live again. Once again, ladies and gentlemen. Welcome to our next segment of the Rodz 776, and let us know in the comment section before we start all this forum, because tonight is a very interesting one. So let us know. Shout us up in the comment section now.
Jesus, you're my Savior, Lord. You died on Calvary. Now to the Lamb of God, who the Son set free is free indeed. Jesus, you're my reason for living. Oh God, Jesus, you're my reason. I love you every season. You're so amazing. Jesus, you're my reason. Your love has never failed. You shed your blood for me. Jesus, you're my reason. You're the reason, Lamb. You're my reason, Lord.
Many will judge me after listening to this song, because they won't expect me to do a song like this because of the music I'm doing. It's just music. I listen to all types of music. You don't have to be a Christian to talk to God. I express how I feel through my music. So go ahead and judge. It's just my music.
Standing at a crossroad, at a point in my life, it seems there's no way out. Lord, I'm only human. I made mistakes and now I turn to you, the better. So many things in my life, Lord, it's not going right. Oh no, I still give you the praise, Lord. You've paid the ultimate price. You've given me life. So take my burdens away, 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 Lord. Take my burdens away, 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 Lord. Now, good friends, I know I could count on. You've given me beautiful kids. They always made me laugh, even when I'm sad. So Lord, I wanna thank you. Although right now my life is upside down, but I know you'll make a way. I know, Lord, please don't forsake me. So take my burdens away, 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 Lord. Take my burden.
Alright, so once again, ladies and gentlemen, sorry about that. We had some technical difficulties, but unfortunately we have Minister Anderson here trying to fix it. But nevertheless, we're grateful, we're thankful. Big up yourself, Minister Anderson. And once again, I apologize for the technical difficulties, but nevertheless, we're here, right, ladies?
Yes.
Yes, man, we're here. So we're about to start this forum. So remember to share up the link and send it up to your friends and loved ones and the enemies and feel like the haters them too, because them alive, and once they're alive, so there's breath breathing in our lungs. So if you're sick tonight and you need answers, we can't really give you the blood pressure reading tonight, but if you have any questions, we can definitely see if we can approach it the right way. Not sure. Alright, so in the meantime, between time, remember the call-in line is 845-682-0652, and remember, put the 1 before the 8, especially if you're calling internationally, so we can get you in the call. Not sure. Alright, so nevertheless, ladies and gentlemen, boys and girls, haters and supporters, Sister Michele, how you feeling?
Great.
If you can hear Sister Michele, me know because she nervous running like myself, I tell you. Sister Melonie, how you feeling?
I'm good, brother. I'm good.
You good?
Yeah.
Alright, so once again, ladies and gentlemen, if you can hear these powerful ladies, let me know in the comment section if you can hear them very clear enough. In the meantime, between time, DJ, talk to it.
So take my burdens away, 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 Lord. Take my burdens away, 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 Lord. Now I give you the praise, I give you the glory, I give you the honor. So take my burdens away.
Alright, so let's get this forum started, because Sister Michele, oh, you, boy, me look, yeah, rub your leg now like if you're nervous. Talk to me now, man. This is a forum where it's not easy when the camera is on you, and you're live. It's not easy. So bear with us, even though I am a host, but I'm still nervous.
You're alright.
Alright. So little short introduction. Sister Michele, tell us about yourself. Not a little about yourself, but tell us about yourself.
I'll tell you a little about myself. So my name is Michele Blackburn, and I am a registered nurse with a doctorate in nursing practice. Mm-hmm. My specialty is psychiatry, leadership, and geriatric. Passionate believer, Christian, love what I do everything because Christ has strengthened me, and I give service because He has given me everything that I have to do what I do. Amen. So that's the short version of who I am.
Amen. Well, I'm at like a church. I say amen. Yes, man. Sister Melonie, tell us about yourself.
My name is Melonie. I too am a Christian, a believer, a daughter of Christ. I am a registered nurse. I've been doing it for over 10 years. Wow. I work in the emergency room specifically, so I see kind of all types of patients because the ER is, you take everything, anyone,
Whoa.
anytime.
Whoa.
So I don't know everything. No one knows everything, but
That's
I know
right.
a little bit about a lot of things.
That's right. That's right. Well, thank you, ladies. And I can say I'm privileged and I'm honored to sit amongst such wonderful, intelligent, vibrant, strong, educated ladies. It's an honor and it's a privilege, to be amongst. Not your minister. Minister said another year. Yes, well, ladies and gentlemen, it is a great privilege. So, remember, the call-in line is 1-845-682-0652. If you have any concern, if you have any questions, feel free to call in and we will approach your questions as precise and accurate as possible. So, ladies, what comes to your mind when you hear about mental abuse? Talk to us.
That's a broad question. What comes to my mind when I hear about mental abuse is it could be verbal, physical, and of course mental. Of course, it could be also domestic violence. It's abuse that is happening, and it could be happening anywhere. It could be in your home, It could be even on the job.
That's right.
It could be anywhere. And it's something, as you say, mental. So I'm going to, I guess, focus on mental. It is something that affects your psyche. So it is abuse that affects your mind and prevents you from, or can prevent you from focusing, because it affects your psyche. So therefore it prevents you from doing what you need to do. It's, and I'll probably give an example to make it, I guess, more sync. Say you are married and your spouse continuously tell you are so fat, you're so ugly. That is definitely a mental abuse, because it's the continual telling of that you're so fat. There's nothing positive about that. So that's what I would say when it comes to mental abuse.
Strong. That is a very strong one. Mental is very powerful, you know. It impact a lot of us, especially in our black community. They tell us, say, growing up, I used to hear some neighbors just say, you walk this like your papa, you not come out to nothing good. Eh?
Right.
You say words like them, man, you just sit down there, you cream them, and it mentally you focus on those words. It's like it manifests within your life and within your self-esteem as well. But you have to know to speak over your life. You know what, Sister Melonie, talk to me. What come to your mind when you hear about mental abuse?
When I hear the term mental abuse, I will say that it's a term that we're now as a community becoming more comfortable with embracing, because I don't think it's something that we recognized in our community for a long time.
Still.
But I think that the power of the mind is incredible. So anything that you manifest in one's mind, whether it be in your mind or someone else's mind, can manifest itself to affect, as you said, Sister Michele, mentally, emotionally. It can affect you spiritually, and it can affect you physically.
Come on now.
Make you physically ill. But mental abuse is kind of like disrupting your state of mind. In many ways, it could be gaslighting, it could be lying, it could be, you know, putting you down, it could be that type of thing. But it's disruptive, negatively disrupting your mental state.
That's right. That's true. Powerful, ladies and gentlemen.
And can I just also, as you mentioned, growing up, I know that growing up, and I would say the Caribbean, of course, because I am from the island. I think yes.
We are me and American, yeah.
I think our people use that, and they will say, to make us strong, to make us tough. You know, they thought.
All right.
They thought. And so, and it sat there somewhere in the psyche of many of us minds, and caused a negative effect. And so we've seen it over the years of many homes being destroyed because you didn't know what love really is. And so we have seen issues and problems and abuse, and right along generation cursed that cause because of that. Because mom told you you're just like your daddy, that worthless man. You're good for nothing, boy. Me no want to see your face. Tell about your business like your daddy.
Take time.
And it's not your fault that mom chose to have you with him, but now you are suffering from what mom is saying, and you never let it go.
True.
But you try to do better than your dad that you probably didn't even know. But somewhere in the back of your mind, you're doing the best you can so that you're raising your children and not speaking negatively to them.
That's right.
But ever so often, it escapes. Why? You never got treatment. Because, of course, what did we know
history
about
raising?
And so, you know, when we knew better, we did better.
Right.
But for a long time, we saw the effect on our children and our, you know, in our homes, in the Caribbean homes growing up.
And this is why them say you have to learn to break generational
curse. Yes, over our lives.
They don't understand, You see words. A lot of people say, just like me. I will say this, like sometimes words don't have an impact on me unless I allow it to. But then again, not everybody thinks like that. Words are powerful. Just like what the Bible said, there's power in the tongue. Whatever you speak, life art. Come on, man. Come on, man.
So even if your child is smoking, and I'm going to say the MJ, and it's wrong, do not class that child.
Come on.
Use a better phrase, use a better, to tell them what you're doing is wrong, what not, dirty boy.
All right.
Smoke the MJ. Boy, you're not come out to nothing. Exactly. But for us to do a little bit than what we did and what our parents and grandparents and great grands, because what they did, because they were doing the best that they could for us.
Right.
But we have been educated and know that my son or my daughter is doing something that is wrong. And I'm going to love her from a place of hurt. And I'm going to correct her from a place of hurt. And the words that I'm going to use from a place of hurt, because I'm hurting. But the words that I'm going to use over her will not be those words, because I know it is, not the correct words to use.
Yes.
Because it's abusive to our psyche, to our mental. So
this is why we struggle a lot, because we can't move on from the past, because some things that was prophesied over our life before is still lingering, and because most of our parents were not spiritually inclined to break and to cut and
pray for us and listen, wake up 3 o'clock in the morning and storm the house. Well, I thank God for Jesus.
Hey, I tell you, Sister Michele, you know what? I need to bring you back on different and not touch on the medical farm, but we're gonna touch it. Know yourself, it's the first but won't be the last. What you say, Sister Melonie? How you feeling? Feeling good?
Yes,
Well, I love a Rasta earrings, them and out in the line. I go out with things. But alright, we're moving on. What are the most common mental illnesses you guys can pinpoint tonight? The most common one.
I think according to the American Psychiatric Association and National Institute of Health, the 3 top one is depression, anxiety, and what was the third one?
PTSD, bipolar disorder.
Yes.
Okay. All right. So with all these stuff that's happening now, what's the age group you just said you would say these illnesses mostly affect? Because y'all in the field and see all these things coming in. So what are the age group that you guys see affecting mostly by these illnesses?
Well, there's different psychiatric diagnoses and there's different illnesses, and depending on your age group, your family history.
History.
Yeah.
Really?
Predisposition, they would call that. Like if you know of an uncle or father or grandfather or granduncle who suffered from bipolar disorder, which many of us wouldn't know because they would not have been diagnosed with those. Would have just said mad, or whatever.
Take your time.
Those, so different age groups, different, predispositions would give you the tendency to have a disease. So anxiety can start very, very young. It can be, as early as 5, 6, 7. Depression, yes,
or even younger.
Yes,
because anxiety we have mild, which is what I had when I walked in here. And I testify.
Yeah, go ahead,
when
sister.
I walked in here, I was mild anxiety, right? And then you have moderate anxiety, then you have severe, and then you have panic. Then you know that you're not in control. So mild is what everybody has. It's a-okay to be mild. It's natural.
Yeah.
But when you're reaching to the moderate, now you're at severe, now you're panicking, you need you need help because it's abnormal.
Oh wow.
Yeah, so a child, as Mel said, can, and let's say why this child is having, we'll do a history. Why is this child having an anxiety? Maybe because mom and dad is going through a breakup and dad has moved out. So now this is an unstable environment. And so this child was very attached to dad. And because dad left the house, now he's having anxiety. And it's no longer mild. It's moderate because he was very close. It's a male child.
Right.
And he was very close to dad. And even though dad has visitation rights, and even though dad picks him up,
it's not the same.
3 days a week, it's not the same as coming in, waking up, seeing dad, you know, do what he does with dad, play football, play whatever. Right. You know, boys being boys, dad and boy. It's not the same. So he's very attached to dad, and dad has now left the home. His mild anxiety now is going into panic because every time dad drops him off, he doesn't want to leave the car. So now,
scared of
you know,
seeing him back.
Yeah, he now needs help because mom will not be able to handle that child by herself because that constant, I'm not getting out of the car. That constant, where is dad?
Oh boy.
It's too much for him now. His heart, and Mel can speak to that because she's the ER nurse. Talk to me. Mom may have to call 911 because the panic attack, all of his heart rate now is now beating out of his little chest. Whoa. And that is not good for his heart. So
can't take a pressure.
Yeah. It depends on the presentation of the patient that we see, and that is how they're diagnosed. And diagnosis is done through the DSM. And
which is what's it mean? DSM? Break that down.
The DSM is what we use in psych to diagnose mental illness.
Okay.
And like so to differentiate the different types of mental illness.
Because you know, viewers they are watching them probably like, what's the abbreviation for that one? So you know, I have to break it down for them, you know.
Yeah, and so it will tell you that from, you know, depends on what is happening with this child and the presentation of the child, and that is how we will say, okay, this child now has anxiety, and it's anxiety with panic.
Gotcha.
Panic anxiety.
Gotcha.
And if Mel sees him in the ER, they will need a pediatrician and all of that, and they'll take it from there, and then maybe a psych consult.
There's a lot of work then
to deal with him.
Just a lot, man. You guys have a lot dealing with. It's not an easy task. Just like in the army, a lot of people, as you lose a leg and lose everything, they all come back right here in the medical field. So everybody's job is, I would say, it's not easy. But when you think about in the medical facility, especially Sister Mel working in the ER, seeing all different type of cases, and Sister Michele that have to be making such rational and important and yet still keen decision, it's not easy. And like me and Mr. Marcy, got little pharmacy or something over the thing and just take a pill and just calm yourself down, you know. But when you reach the stage, you have to reach Sister Mel on the stage, and boy, you're rough. So ladies and gentlemen, if you're out there, you know, ladies and gentlemen, just as I said before, the struggles are real. So if you're out there and you need help or anything, feel free. You know, don't post it in the chat because you know you want to be discreet about it. But reach out because there's always help. Once you reach out, somebody's always here to assist you. All right. So we're moving along nicely, ladies. How you feeling so far? Good. I'm gonna shake it up a little bit, you know, cause you know, Sister Michele, I get warm up and I like it. You say it was at mild, so that the mild gone now. You're out of that now. So let's touch on this one now. Are there warning signs of suicide?
Yeah, the person is focused on death. They talk about death a lot. They may also be giving away their personal items. They may have also attempted suicide recently. They have, and how they have attempted may be different methods. So there's different methods of how they've attempted, right? You know, and they're just fascinated. The constant I'm going to die. So we need to take those things seriously.
If
we ever have a loved one that is fascinated by watching movies that are those gross death
how
show,
to kill,
planning, plotting, or I know recently there's been stuff about their Facebook page or their Instagram
cyberbullying.
So we have to be careful. And if they have taken all their medication all at once, of course that's an attempt. Those are things for us to focus on.
Sister Mel.
This is a very
hard, tough, touchy, sensitive. So
we as humans there's a saying that says we are greater than the sum of our parts. And it's not easy to be able to pinpoint something and say, yes, this is a diagnosis, here's the pill, and you are cured.
Everything is good.
That goes for medical, like your body, and it goes for your mental. And so when you ask the question, what are the signs of someone who wants to kill themselves, that's not really an answer I can give you that say, oh yeah, when you see this, that's definitely somebody who wants to harm themselves. It is a broad spectrum. There's so many. It manifests itself in so many different ways, and people express themselves in so many different ways.
True.
And people don't express themselves in many different ways. It can be something as obvious as somebody who is researching how to kill themselves, and sometimes it's not that obvious. Sometimes it's somebody who is just so broken down that they can't even speak. They don't have the energy to go to work anymore. They've lost interest in their appearance. They've lost interest in their spiritual walk. They've lost interest in their relationships, the close relationships around them.
Cut off people.
Because they have lost hope. And people's mental health, however it manifests itself, is not always clear cut. So to be quite honest, that is not a answer that I can just give you and say, yes, this is the clear signs. But when you see a change, I would say change is probably the clearer way of recognizing something that is off or different. When you see a change, and you can't come out and say, are you thinking about killing yourself? It's not like that.
Yeah.
It is really just about noticing and being there and offering support.
Wow.
In any way that you can fit in, whether it's spiritual support, talking, listening. Sometimes just being there and sitting in silence. Because the feeling of feeling alone
is real. Struggles, I tell you about it.
And sometimes people look at people's social media, or they see them in different spaces, and the perception, whether they look nice, dress nice, behave nice, they're social, is that they're happy, or that they could never suffer with something that I'm suffering with because I don't know how to dress like them, or I'm not social like them. So they have it all together. And that's not always the case. So that is my sort of all over the place answer.
On point.
That's the most honest.
And I know a lot of people, they can relate to exactly what you're saying. So nothing that you're saying now, don't feel like it don't make sense, because everything that out of the word, out of your mouth right now, somebody on the next screen is just like when I had a live here and Sister Michele said, I was in my living room and I wanted to watch a movie, but couldn't watch it because I was so in tune with what's going on. So you never know, there's always somebody on the next side of the screen that's going through something, and just hearing this, hopefully, as I said, reach out and be encouraged, because these ladies are powerful and they're educated and they're led by God. So that's the next.
And it doesn't matter, suicide doesn't matter the age, because you have young adults, you have children, and you have elderlies.
Right.
So it's not the age of the person that that
it's
causes,
just a number.
Yeah.
Just like how they say love, you can't define love by your age, because age is just a number. Alright, sir. So we're moving on nice. It's getting warm in here, Sister Michele. Me say I have some notes and that thing, more know what going on, Okay. I want to big up to everybody who's watching right now. Remember, the call-in line is still open. 845-682-0652. And remember, put one before it if you're calling internationally. In the meantime, DJ, talk to him, man. What go on? Alright, so ladies and gentlemen, we're shifting a little bit to the men now, so we know there's a lot of men out there that are scared to do certain things, and I am one of them, cause nobody wants to hear, you go to a doctor and you hear some news, it sound like a Freddy Krueger or some horror movie song. Everybody wants to hear Jingle Bells and Merry Christmas, nobody wants to hear nothing bad, So, question, ladies. When should one do a prostate test? What's the age you would suggest for a man to do a prostate test?
So that kind of all depends on your predisposition, as we spoke about earlier, or otherwise your family history. So if you have a known family history of prostate cancer, then you would want to get tested earlier.
What if I don't have that
information?
Yeah, like me don't know nothing about all them things upon my side. Me know say the diabetes on my side is there, and the goiter, I should say, but the prostate part, me no know about it, because me born, as they say, nothing wrong. So if me want to find out something that me go and do my physical, everything come back clean, me still want to know certain things. So for me, we're curious at the age of a young age, still on the calendar.
The recommendation is about to start at about the age of 40, and we're between 40 and 54. Yes, and there's different tests. There's blood tests. There is the digital exam by your provider, and then the ultimate test that is going to give you a diagnosis if there is an issue is a biopsy. Some of the
radical one. So if me do the blood test, it will show still in the blood if I go ahead and do the blood test, correct?
So it will show signs of the potential of you having issues with your prostate. So there is an enzyme. It's like something specific to your prostate, right?
Right.
So it's like if you think about like a cuisine, right? If you think about spaghetti, you think of Italy, right? If you think about rice and peas, or you think about curry, so there's certain things there's certain enzymes that are specific to certain organs. So there is an enzyme specific to the heart called a troponin, right?
Talk to me now, man.
And there's an enzyme specific to the prostate, and it's called a prostate specific enzyme, PSA. PSE, sorry.
Okay. Yeah.
And so there are markers in your blood that can show whether those enzymes are elevated. Now that will only put you in the direction saying that you have a certain chance of having prostate cancer. But the ultimate diagnosis with anything, with cancer, with any type of cancer, is to have a biopsy. And a biopsy is literally taking a piece of that tissue, going in, surgically removing it, and sending it to a lab for them to assess it and say, yes, this is the issue.
That one that sounds scary, my brother.
So that's the most invasive, and it does come with risk, and not everyone needs that.
Right.
But you start off, usually in medicine, you start off kind of low and you work your way up. Okay, so
going up the ladder.
Yeah, so you would start with the blood test or a digital exam, and then if there's cause for concern, then they would move on to the more invasive test.
Got you. So if you're watching this live, you know, if you're close to it, about 40, if you're 39 and not the borderline of 40, I would encourage you, you know, don't be scared like myself, yeah. Go ahead and get tested, you know. So Sister Michele, oh, you have something else to say, Sister Mel. Sorry, I see.
Just if you notice changes, like changes or a bulge or changes in your urine stream, pain, it's always good to go and see your medical doctor and discuss with them anything that you're concerned about. It could be nothing, but it could be something, and things are changing in our society with our foods and with antibiotics and steroids and all kinds of different things in our foods, and so it's changing the way our bodies are behaving and reacting. Girls are having their periods earlier. There's a higher rate of so if you're noticing a change, go and speak to your primary doctor about it. If you don't have a primary doctor, you can go to a clinic, because not everybody has insurance or has a primary doctor. You go to a clinic and they can refer you so that you can know what's going on with your body.
Guys, I mean, I tell them insurance people, they come like some care insurance every 6 months. They want to upgrade the plan. I mean, I tell the people out there sick like a wow, and because of the insurance policies and all these things and the stipulations about how this country is running. A lot of people want to enter the doctor's room, but then going in is a scary point, but coming out again is a worse scary point. When you look at the bill they come, you're gonna say, whoa, it may never go.
Yeah.
But at the same time, you still want to know what's going on, because prevention is always better than
cure.
Amen. Yep. Sister Michele, talk to Wagwan.
So there's really nothing to add based on what Mel says. So, but I just wanted to say that I know men are always afraid because they don't want the doctor to put the gloves on. So let me tell you something. Go. Get the gloves put on.
Jeez.
Get it done quick.
It's quick.
She says quick.
It's quick.
It is.
Yeah.
It is. And it's best to go hear what's there or not, and then so your treatment can be started. If not, then you're clean.
All right. So you're speaking to me now. I'll take that in. And that's the mild anxiety that we just. Essentially with them words. All right. All right. I like that, Sister Mitchell. I see you gone out of the mind now. I see you're comfortable now. I love that.
I'm in my comfort zone.
All right. So we can touch on some. All right. So we're moving now. What's the next? This is the question. Talk about Mr. Damien. They need to find another way to talk to me now, Dejan. Talk to me now. I tell you, listen, me I tell them, man, because the test kind of.
It just happens to be the location of the prostate, and that is the most effective way to. Yeah.
Unfortunately, that's how the body is.
Oh, jeez, man. Oh my. Hey, I'm a testify right now. You see, it's gonna come on to me and needles. I am not telling the line every time to do a blood test now. They have to make sure a bottle of water is in front of me, and them have to, distract me over there. So because it's once I see the needle, me start like literally cold sweat. Me start feel like make a pass out, like literally. Wow. Do not count. If you're gonna stick me, just get it over with. Don't count. It's once you start counting, don't make say no. Take it out, please. So
do you tell the phlebotomist that?
Every time I walk in the room, I say, listen, before I sit down, I said, I don't want to see the needle. I don't want to see I put on the gloves. Let me just sit down, the time in hand, just do what you have to do.
Don't count down.
Once you count, I tell them to get up out of the room.
Oh my gosh, wow.
No count down.
No count down. So, men out there, I'm not the only one, because I know I'm scared of needles.
Men are worse.
Yeah.
See?
They are. I will have a patient that is jacked like this with tattoos all the way, and he's sweating, and I'm like, but you have voluntarily sat down in a chair and paid somebody to mark up your hole, and I'm just trying to do one little.
It's rough.
And they're running out to the chair.
Yes, but I don't judge because that's just
that's just how men are typically, I think, make made, the needles and the snake, let's not even touch that. But anyways, how often should one do a colon examination? That is our next one too, the colon test.
I think it's sort of similar to the prostate in that it depends on your family history. Now, if you don't know anything about your family history, the age is very similar. I think that the age actually moved up. I think it was once 45 or 50, and now it's like, I think it might be 40 if you have a strong family history. And you can get it done earlier if you're noticing change in your bowel movements.
Talk to me. What about that now? The changes, like you're seeing some like in the flag in front of a cow, the red thing there. Talk to us. So what kind of sign you see?
So I mean, definitely if you're seeing, so it depends. So if you're seeing pus or mucus in your bowels, that is very concerning. You definitely need to go to
something wrong with you.
Yeah,
it's not no bump. It's not no bump. We have look up us. It's something else.
Yeah.
So
if you're seeing pus or anything like that in your, it's something to follow up definitely with your doctor. And don't be shy. Tell them exactly what you're seeing, what you're feeling. If you're having fevers, things like that. If you're seeing bright red blood. Now, this is assuming that you're young and relatively healthy, and you're not on things called anticoagulations or blood thinners. Sometimes you can have, people have pile, or what's the other word for pile? In the lower rectum area. And they can bleed, and they can cause you to have a little bit of redness in the toilet if they bust.
Yeah, and if you were straining and all that.
Oh yeah, talk about that thing that when they're taking a number 2, if that should drop different. I mean, I say like the ball or the man, if that should drop a problem.
Hemorrhoids.
Yes. The hemorrhoid. See the medical people. Talk to me, man.
If you're seeing like tarry dark stools, that is more indicative or showing that you have a bleed that's like further up
somewhere
in your GI tract.
So not what you eat. If you come out like that, it's not what you eat or something like.
It could be an ulcer that's bleeding, and now the blood is no longer red, and it's actually digested blood, and that's why it's tarry. So it's darker, and so you're kind of pooping out digested blood.
So you didn't eat chocolate.
Scary.
You didn't eat chocolate.
And it's not because of your melanin in your skin.
No.
Wow. That's scary. That's scary.
Any changes in your poop, really? Any changes that you notice that is like abnormal, you should go and talk to your
fellas, brothers, make sure you take heed. Brother Richard Staple, he asks a question: what is a good PSA score?
It's a good question. I don't know the exact answer. I'm not sure either. You're
on the right platform, my brother, and you will get answer for your question. So stick around, But boy, this forum it's I'm learning a lot. It is scary. I almost sound like the Twilight. It's certain things you're not prepared for, but when it comes away, you have to just man up, and just go ahead and take it. So,
according to the Johns Hopkins medical website, they're saying that for age range of 40 to 50, a PSA should be like 0.6 to 0.7. Anything 2.5 and above is considered abnormal.
2.5 is abnormal. Okay, so anything below,
that's for ages 40 to 50.
40 to 50, okay.
And ages 60 and above, anything 4.0 and above is abnormal.
So you see you run into the bathroom.
Yeah. Drip. Talk to me, Sister Mitchell. Talk to me, Doc. So, Brother Richard, I hope you're satisfied with the answer. Hopefully, you stick around still and learn a lot from this forum as well, like myself is doing right now. So, ladies, I want to say thank you for answering these questions, and these are very important questions that I know in the future people will watch back this live and learn from it, because I know a lot of people still at rehearsal in church are preparing them Sunday dinner from overnight, so I know most of them have people catching all them things, but don't worry yourself, we're here. So the next question, my ladies, what is a good, or I should say, what is the ideal blood pressure reading? So for me, if I have a 160 say 130 over 40. What would you say?
Okay, 40 is low.
130 over 130. You said
So-
130 over 40.
So I'm just saying, what is an
okay.
ideal?
Ideal. I mean, it has changed recently, but ideal is really 120 over 80. But anything, I want to say, when you start getting into the 130s, 135s over 85, it's starting to become pre-hypertensive or, hypertensive.
So at what stage you say I'm a walking dead if the reading should come up?
Just like anything in medicine, there's no magic number. Everybody is different. Everybody's tolerance is different. Like when you're pregnant, your blood pressure changes.
It fluctuates up and down.
Yeah, there's. So I mean, anything, and it depends on your situation.
If you're an athlete, if you're obese, it really depends. If you're diabetic,
Your
it depends on your
diet,
diet.
stress.
Yeah. But that 40 is very concerning. Why is that bottom number so low?
Yeah, that's not normal.
So I'm sure your doctor would.
That was just a number you picked.
Yeah, no, that was
Okay,
just a random number.
yeah.
That was just a
Okay.
random.
It says you picked a very low number. If someone is out there, if they had that low number, that would be a person that the doctor would be following closely because that's concerning if they're not an athlete. What is happening? Why they're having such a low number?
Low number.
Yeah.
Makes sense. Okay. All right. That's just nice. I just love this forum. DJ, we're feeling. You learning as well? Make sure you're not a spin wheel over there. Make sure you spin the ears them as well.
I wanted to say something about the blood pressure. There is they call it the silent killer.
Yeah.
And the reason they call high blood pressure the silent killer, particularly in our community, is because you don't really get symptoms. And if you're having symptoms like dizziness and nausea and headache, that's actually very, very concerning because that means your blood pressure is very high. So people who say, "Oh, my pressure is fine, I don't have no headache," that is not a good measure of your blood pressure.
Right.
Measuring your blood pressure is actually measuring your blood pressure. If you are on blood pressure medication, it is imperative, especially as you get older, to take it as directed. Don't take it when you feel like your pressure is high. That's not what these medications are meant to do. It's not like Tylenol where you have a headache and you take the Tylenol and it makes it better. These are medications that are meant to be taken regularly so that you can keep your blood pressure in a healthy way, so your vessels are not being strained, so you're not putting yourself at risk for stroke and other issues.
Wow.
So there's something I want to mention about the blood pressure thing, especially with men.
Talk to me.
If you are being prescribed hypertensive or blood pressure medications and you're not taking it, your doctor, your nurse practitioner, your nurse knows why you're not taking your blood pressure medication. It can affect your ability to maintain an erection. And that's why, especially in the ER that I see and people that I talk to or just conversations, I'll ask them, why are you not taking your blood pressure medication? They won't tell me why.
Right,
I'm talking about a man, but
Pride.
I know why. Yes, because it will affect your ability to perform. And that's difficult. That takes a toll on your mental health. It takes a toll on your relationship.
You as a man.
Yes.
Overall.
How you see yourself as a man.
Yeah, that's it. Because of the blood, you know what? Go ahead, sister.
Yeah, and this happens to young men. It happens to older men, and it happens to middle-aged men. This is not just an old men problem.
It's a man overall.
Yeah, but it is not. It is not signing your death certificate. There are people who, if they change their diet and lose weight and exercise, even just moderate exercise, they can come off of blood pressure medications. It's possible. It is possible. Decreasing your stress, which is not always easy to do, but is possible. You can come off of blood pressure medication, but it's important to take it if you're prescribed it because it can literally save your life.
You hear that? So if you have testicles, this goes out to you. You know what I'm saying? So don't take it for granted. Once you have something we God bless you with called testicles, this is very important for you. So take heed, because these ladies know what they're talking about, and we as men sometimes pride take a lot out of our plate because we could again we lose because of pride. So take heed,
And don't
gentlemen.
take the blue pill and not take your blood pressure meds.
Oh, God.
Take both.
So what? The blue pill. Talk to them about the blue pill. Yeah, touch on some things I mean I know about.
Don't you know
Enlighten
the
the
blue
forum with the blue pill.
That blue pill, take your blood pressure meds. But if you're taking that blue pill and not take your blood pressure meds, that's a no-no.
Okay, all right. So y'all should know what that means. We'll talk off here. All right, ladies, I love it.
And that's okay. There's no shame in that. There's no shame in if you need the blue pill or whatever pill, take it. As long as you're being followed by your doctor, because there are side effects to everything that you take.
Everything. Even when you eat.
Yes.
Okay.
And so you can put yourself at risk for some serious problems if you're taking the blue pill and not taking your blood pressure medication, if you're not staying hydrated. Because basically the blue pill is opening up your pipes. It's opening up the vessel so that blood flows to the areas that you are requesting for it to flow. Yeah.
Once a man, I know what that should mean already. Me not have to do not say no more.
Exactly. And that's what you want, right? That is going to give you the effective erection, and so exactly. So, and that's the purpose of it. But that has side effects. And if you're not taking your blood pressure medication, if you're not staying hydrated, and the vessels open up, and the blood is flowing to that particular region, if it's flowing into a region, it has to flow out
Come on.
of a certain region, and that would mean your brain and other organs, and so you can get lightheaded, you can pass out, and that can be a very scary moment. So there's no judgment. It's all right if you need it.
Judgment-free zone.
Exactly. Come on, right here on the Rodz 776 platform. I tell her, no judgment. As I said, you used to correct me on that word in a DJ. You're not judging anybody. We're what you used to say? Don't use the word judgmental. What you say?
Say, I won't condemn you.
All right.
Judge you.
All right. All right, but there's also some natural organic sources out there to boost testosterone. If I'm correct, if you ladies.
So I'm not well versed on that particular.
Okay.
I will say if we're talking about like health and diet and things like that you will always be on top if you're eating a healthy diet and have a healthy lifestyle.
And that's something I'm going to talk on you too.
Yeah, I mean, they say things like there's a lot of different drinks and stuff. Staying hydrated, ginger roots, things like that that are supposed to help you, in
elderberry and all them things,
That's good for your immunity.
So I know why you look at things. All right. So we're moving on nicely. How can one tell when a stroke is happening?
So there is an acronym or a set of letters that we use for people to remember, that's supposed to make it easy for people to recognize stroke symptoms, and it's called BFAST. BEFAST. And essentially what the BFAST acronym is trying to convey is that if you recognize any changes in their balance, that's the B. The E is for, I think it's eyes, vision changes.
Make sure now take notes, especially if you're watching this, living with somebody, especially when we're grandmothers, grandfathers, and it doesn't have an age group, as the ladies would say, so be very
cognizant.
Right, they're being very meticulous right now. So if you have a pen and paper, the B fast. Make sure.
So that's the B and the E, and then the F is now for face, and that means if you're noticing any drooping in the face, particularly what they would say unilateral or one-sided. And then the A is for an arm drift. So if you were to hold up your arm, and usually when we test for it, we ask you to close your eyes, and then you'll notice that one arm will start to kind of drift off.
Is that so?
Yeah. So that's the A. S is for speech. So if you notice a change in speech, like slurred speech, or inability to speak at all.
That's what I was going to say, because what if they...
Either or.
Yeah, either one. So speech in general, if change, whether you can't speak or slurred speech. And then the T is for time.
Time
Time is of the essence. So the faster that you recognize
Oh.
What
these
is
symptoms, the better chance you have of fixing it.
Okay.
It's
Whoa.
a very scary thing to witness.
Very.
Yeah. And it can happen to young people. And it has been happening to young people for a myriad of reasons. It's less likely in young people, 20s, 30s.
Right.
But it can happen.
Yeah, I remember it used to happen to my father a lot, and it so happened when I was always there. When I was in Jamaica, I used to work at Sandals and Beaches resort as an entertainment supervisor. So I used to get day off every day out of 2 weeks, and so happened when I'm in church, and I always looking at him, because once it happened one time, that phobia is like, oh man, is it gonna happen again?
Yeah.
Please, Lord, don't let it happen again. But every now and then it happened, and then I'll just watch him just slowly drifting to the side. His features start getting dark, and I'm like, he's starting getting cold. And then I'm always running to him. And once I stop playing, everybody's gonna look like, okay, something is wrong. So I always run to him so he don't hit his head, because he's blind. So when I try to help him, and his mouth, I realized his jaw was tight. And he started getting cold, and I'm like, what is this? And when I go to the hospital, the doctor was like, he had a mild stroke. And I'm like, stroke can do something like that. I know it can make you bend up some way, but features changing as well. So it's scary, as you said. It's not something that anyone seen happen panic. Because even me don't even know if I do. First of all, me start cry bad. I don't know if I do. There's a lack of knowledge, people perish.
Yeah.
I tell her. So people, make sure you take note of the be fast. Time is of the essence, as what Sister Melonie said. So, Sister Michele, what do you have to add to this one?
Yeah, just as Mel said, time is of the essence. If you're home, call 911. Exactly. It doesn't matter where you are. Get the person to higher level of care, because they need to start the busters to get whatever is going. They need to get you going.
Right.
So time is of the essence.
Nice. Sister Hillary Hines, she said, great forum, indeed, great information. And as well, Brother Richard Staples said, very helpful, and the BFAS acronym. Thanks. Yes. So, ladies and gentlemen, remember, the line is still open. So feel free to call in and ask a question. If I'm not touching on some of these questions, feel free to call in. The number is 845-682-0652. And remember, international callers, put 1 before the 8. All right. So we're moving along nicely. All right. Boy, I'm telling you, I get steamy. Sister Michele, you touch on something about you say the way you eat and diet and exercise and stuff like that. But the question is now, what is really a balanced diet? If you don't mind me asking you first.
A balanced diet, as they taught us in school, is to go by the pyramid. So when we look at our dish when we are eating, they said it should be colorful. Not like us, so we have pure dumplings.
Well, for the banana dumpling color, the rundown is not a part
of the pyramid.
So it needs to be balanced. Everything needs to be in proportion. So proportion and size matters.
Boy.
And green leafy vegetables need to be on our plate. So when you look at it, it should have a little red over here, a little green, a little of a little, colorful, and
attractive.
Yes, it's not just what we used to growing up and don't want to eat vegetables and don't want to eat certain things, because it needs to be balanced, because there are certain vegetables that they're good, not certain. Vegetables are good for us, and that's the whole point of being balanced. And so, I myself can speak for myself, who probably don't like all the veg.
Like myself.
But it is good for you, and not just the veg, and not just eating, but with exercise. And recommendation is at least 3 times a week, and it doesn't have to be vigorous,
right?
But it can be walking, right? 30 minutes. So it's 30 minutes of walking or swimming or bike, your stationary bike or
swimming. Boy, we Jamaica, they talk about swimming. They one. Oh, yeah, talk about Sister Mel. Can you not to cut you? I'm gonna come back to you, Sister Mitchell. Can you swim, Sister Mel?
Like a fish.
Sure, I tell you, Sister Mitchell. How about you? Can you swim?
I jump off Rick's Cafe.
Me? Yeah, better have a parachute. A life jacket ready.
Yeah, this year we can look for the water.
If I go in the water and it start past my chest, no, take me back.
That's a no.
No, that's a no for me. Not even go underneath. No.
Yeah.
Sister Mel, big up yourself still.
Yeah.
So finish up, Sister Michelle, as you were saying.
It's the diet, what we eat, and add exercise to it that gives a balance to everything that we do. And of course, because we are Christian, I'm going to throw this out to our spiritual
talk
is very important as well. So everything in consideration with the spirituality goes hand in hand with that. Yes.
Boy, me
fasting
love
and prayer.
John, know that hard. Boy, the fast is no, me not tell the lie. Still, confession is good for the soul, but boy, me love my food, but fasting it's been a while, and I need to be better than that.
I am not your priest, that I'm not your pastor.
I mean, I tell you,
take a confession.
But you have to stay rooted and grounded, as Sister Mitchell said. It's very important. Take heed, fasting and eating right. Sister Mel, what you say? What is a really balanced diet?
I think that the most impactful thing I've ever heard about a diet. First of all, let me start by saying that like the fads and the different things, you have to be very careful with them because sometimes they're trying to sell products. They may not work for you based on your medical condition or your allergies or what have you. But the most profound thing I ever heard was 2 words: eat food. And I thought to myself, what does that mean? And then I read it again: eat food. And simply put, if it didn't grow, don't eat it. If it's processed, don't eat it.
Boy, we live in a country, everything has a process, especially all the lettuce them.
Cracker, well,
some plastic
chips and cookies. Processed foods are some of the worst things that you could put inside your body. Processed meats.
So hold on. So even the Jamaican plantain chips and the ripe plantain chips.
Well, those aren't necessarily processed. Well, if you're making them from scratch. So if you slice the banana, you dry it yourself, you put a little salt on it, then that's not
so
processed.
The supermarket one them we see in the bag them price them $2 a bag. Process.
Make your own.
Process. Make your own.
So if you're trying to have a well-balanced diet, I'm sorry, diet soda.
Talk to me about the diet
soda.
Juice,
it's not good for you. Coconut water, that's good for you.
Great for your heart.
But most of these ones over here are processed too, so
they might be, and that's yes. I prefer the ones that you have to refrigerate because the ones that you don't have to refrigerate, they have to put certain things in there to give it shelf life.
See?
Yeah.
Scary.
Is that one in the box that? No, we're not advertising. I'm just asking a question.
Oh yeah, I know which one you're talking about.
That's the one I like to get.
It's so good.
Yes.
It's so good. I tell you, the coconut water. I tell you, man, wash out. The older folks used to say, wash off
your heart.
Yes.
I tell you, all the power we have to purge by the coconut.
Yeah, but if you can pick we can't pick no guava off no tree.
Right.
Yeah, but
right.
if it grows, the cashew tree, if it grows, you can eat it. Yeah.
Nice. I try and stick to that because going to the supermarket, I'm a fan of chicken breast. It's anything bone, you know what I mean? So when you go into the supermarket and you pick up a pack of chicken breast and then I said, these chickens, where them I get all these chicken from raised so big and so quick.
Yeah.
But as you say, Sister Melonie, eat food. So me as a breast man, me going in now, I said them and chicken get big too quick.
Yeah.
So how me I go divert from eating chicken breast? I mean, I become, no offense to,
stick with it.
but these are processed stuff as well. So How would I go about doing that?
You have to do your research on which company is not pumping up their chickens with antibiotics or with steroids.
Oh gosh.
I don't eat meat, so I can't tell you which ones.
So I said no offense to all the ones that when I eat meat,
are gonna be trustworthy. I mean, at the end of the day, they're trying to make money.
Mm-hmm.
So they're trying to mass produce.
Mm-hmm.
So I mean, if you have if you know a farmer, if you know somewhere where you can go, a butcher that like gets them straight from literally from farm to table, and you trust them, then that's the best way. But not everyone has that, and that's okay. You have to do the best you can with what you have.
True. Immigration now make you pass with them fowl, because down at Jamaica you have some fowl you feed them pan can and them things. The immigration now make you come through with them.
No, sir.
Them the one. What?
No enter.
No, may I tell you, but these are very important. As much as we're here laughing and smiling, we have to give God thanks, because no need for us to be all serious and thing. But this is a very, very important forum, and even though we're laughing, as I said, but I'm learning a lot, and these ladies are dropping a lot of information on us tonight. So please, if you're watching and if you do get the chance, remember to be fast and all these things. Take note, because these ladies won't be here every other Saturday, because they're working people just like I watch. So take heed, especially men with once you're born with testicles, only me attack. All right, so we're moving along. Nice and easy. DJ, you sound quiet over there, man. Talk to no man, make we hear what going feet now. We're going a little intermission, ladies and gentlemen. We'll be right back.
Lift Jesus higher, a little higher, from the earth to eternity. He said if I be lifted up, I will draw men unto me. Lift up Jesus higher, a little bit higher, from the earth to eternity. He said if I of Jesus and what he has done for me, my soul cries out, hallelujah, thank God for living me. Lord, when I think of your goodness towards me and what
Yes, ladies and gentlemen, so you probably was wondering what they're talking about on the screen. So, let's just share this, so everybody can be in tune with all these equipments that America investing and so-called bringing in to make things easier. Why the test of, what's the word, ladies?
Prostate exam.
Alright. Why it have to go up the one way? There's all these devices and these, mechanic stuff that's coming out. They have to be an next way. But as your sister Mel was saying, I don't want to even elaborate. So that's what they said, Sister Melanie.
I mean, not everything can be replaced with the human touch. I mean, there's ways to, that's just the way to examine it. And when you're trained, providers go through many, many years of education and training. Many, many years.
Too much.
And it's very expensive.
Yes.
It's not just a 6-month program, 1-year program, and they train. If you want to be a neurosurgeon, you're going to be in school and training for about 12 years.
Wow. That's
one of the longest programs.
Residency and everything.
Yeah. To be proficient in a neurosurgeon. And that's just to start.
Huh?
Yeah. And then you have to have the years of it. So it's a lot of years of reading and education and research and practice.
So you have to devote all yourself, just like a priest. You can't have a wife. You have to devote himself to God. You have to devote yourself to the practice and the whole.
Yeah, it's like
Some have wife, but sometimes it doesn't work because of the time that they have to study and live in the hospital for residency and become chiefs of resident chief and all of that. It's a long process. So yeah, it doesn't work sometimes.
It's just like you have to marry
So
to two.
you need that digital exam. Oh my God.
Yeah. Wife I work at. You have a married to the practice and know, so you have the lady at home see me. That's 12 years to start. Wow. Boy. Big up on yourself still in that. So I say me respect on you know. Me not telling no lie now. Some people are called to be and some people are just for sit and just acknowledge that you listen, man. I lift my cap to you because what you ladies are doing, especially you working in the ER, Melonie, it must be scary to see a lot of cases coming in and all these things that you have to be dealing with. I lift my cap to you.
Well, I certainly didn't go through 12 years of education and training. I only less than that, but yeah, it's scary. It's humbling. It's revealing. It's a lot of things, and you have to face your own fears. You have to face your own judgments, and try to deliver the best care to everyone, no matter what their sex is, no matter what their sexual orientation, their color, their religion, and give them the best that you can.
Man, Sister Mitchell, you had been as a DNP doing a lot of making a lot of decisions and going places and experiences. How is that for you though? For so many years you've been doing this. Has it equipped you and you know?
So in my next life I'll only want to lead me.
You hear that? In the next life.
But to answer your question, leading and managing people is quite a task. And sitting at different tables, making decisions that affects many lives, dealing with patients, family, loved ones, managing different cases, interacting with the entire team, it's a lift. Being in this position affords me to be in the entire hospital, seeing and doing things, and it's great. It's great.
Be. Just like being at a hotel and being in the house looking over.
It's great. You learn a lot. You see a lot. You sacrifice a lot. You have panic attack a lot.
Oh.
You know how to manage it to get back to mild.
Pressure a lot. Can you work well under pressure?
Because you have to know how to work under pressure.
Ooh.
So you go from mild to panic.
Oh,
and
real
back
quick.
and back to mild quickly
In one shift.
In one shift. In one shift. And sometimes less than before the shift is over.
Wow.
So it's a heavy lift. It's a heavy lift. But I love what I do.
You have to.
I love
what you're seeing.
Yeah, I love what I do, and I would not exchange what I do. I would not exchange it.
Wow.
Not even to be like traveling and taking vacation and sitting on the beach and drinking pina colada.
I still do that. I still do that.
You see how your post string, you see that? Alright, I tell you.
Because you have to.
Yes.
You have to have me time. And you have to have your own mental health time. Why? Because it's a heavy lift. And you have to know when to step away.
How you know when to step away though? Especially when you know this is what you're called to do, and if something might happen.
When there is so much going on after you have out the fires, it's time to say, okay, I need some PTO. Because if I don't get some PTO, I can't do no more prayer and fasting.
Point taken. I agree with that one.
Yeah. So it's time for PTO.
Right.
Yeah. So that's the human side, because I can't live in spiritual all the time. So the human side of me know when it's time for PTO, so that I could step back, irregardless of my phone going off. But my phone is not going off on the job. It's away. So it's different. So you have to know when to step back.
Wow.
You have to know when to step back.
Yeah, to know when to step back. Hear that? Know when to take a break.
Yeah.
Despite of what job you're doing. Know when to take me time.
Yeah.
That's very important. Alright. Wow. We also have what? 4 more? And we should be seeing is going great. Great. I'm telling you. I'm loving this forum. Minister, how you feeling? Good. Alright. Alright.
He went from I'm not here to good.
Yeah, right. You work with that. All right, ladies. How do I shake this chronic exhaustion I've picked up during the pandemic? How do you transform out of all that was happening and try to not brush it off, but adjust to it? So all those close in, non-communication, not seeing people, restrictions, mask, all of them stuff that have to deal with you, mental, and we as human beings, we physically, touch, seeing your loved ones, and you have to be standing behind walls, behind screen doors, can't touch, can't hug. As young individuals, school, everybody, young people interact. School lockdown, everything, job, people now work, you're lucky. This is very heavy. I see it on the face, Sister Michele. Like I said, how should I approach this question now? No, the question is, how do I bounce back? Or pick up from when?
So for me, I stayed in the hospital from Monday to Friday. I was unable to, because I traveled on Metro North, and Metro North had reduced their service, so it was very difficult to go back and forth. So in order to get to the hospital, I had to, it was like going away on weekends. So I packed. And I went away on Monday morning. And I came back home on Fridays, and I dropped everything in the laundry room
and pick it up back again.
And I picked it up back. So it was difficult for me. And at this time, my mom was then retired. My brother was out of the house, and it was the first time my brother ever moved out. And I was like, thank you, Jesus. Hallelujah. Praise the Lord.
Go ahead, sis.
I had an empty house.
Redemption coming.
Hey! Hallelujah. So my mom had retired. My brother had moved us. I had an empty house. COVID hit.
Woo!
Unbelievable. What an empty house going to do for me now.
That's what I said. Talk to the 4 walls.
Talk to the 4
walls. The struggles are real.
I'm not even there.
Wow.
I ended up living in the hospital from Monday to Friday and going home to an empty house every Friday evening. So can you imagine? I saw no one other than to speak to people on the phone when I got home. And I remember before I started doing that, I remember one morning when they said only healthcare and firefighters and whatever could go out.
Go out, yeah.
I remember one morning I pulled out and I said, "Where's everybody?" Whoa. There was nobody on the street, so I was like,
"Ghost town."
I said, "Oh, I forgot."
Because you're
I'm still traveling and I'm still doing, because my world didn't stop.
How can you stop when you guys are in the
So I didn't so I'm like, where's everybody? And then I remembered, this is why I'm the only one. And then I said, when I got to Metro North in the morning, the train only had 3 of us in that car, and then I realized I had to get off this because this is not safe anymore. There's only 3 people now in this car. So I made the decision to stay in the hospital, and I stayed in that hospital till June, and that's when I know it was time for PTO. And at June, I never forget, I put in for 2 weeks PTO to my CNO. I said I must, and even when I put in for PTO, they told me, listen to this, they needed me to start a new group called Speak Your Truth.
Hey,
I said, what? I need to speak my truth right now. I can't do this no more. I have had enough. And they said to me, will be here when I return from my PTO to start the group.
That's right.
So I took the PTO for 2 weeks. And so to deal with it, I was the one, of course, because when you're in charge, all of the issues, all of the concern of the staff who didn't want to work with that patient and don't want to flow to that unit and don't want to. I'm dealing with this.
Whoa.
And so all of the friends is calling and the family is calling because now they may have children at home that you're not used to having in the house.
Yeah.
And the child doesn't know how to adjust. Mom and dad doesn't know. So all these phone calls is coming in and I'm going, sweet Jesus.
Oh, whoa.
I'm getting it at work. I'm getting it at, personal because friends are calling to say, Michelle, what do I do? Or they're calling me to ask me if there's any therapist at my job to take on any cases because they need help.
Anxiety.
So it wasn't easy.
Whoa. I went from my go straight to.
It wasn't easy. And so coming out of it, thank God I had the skills I had for myself and then had to lend it to friends to cope.
Who was in need.
So
wow.
That's how
That's what Brother Richard Staple said. That's powerful, Sister Mitchell. I want to salute you ladies and thank you for what you do, Brother Richard. And Ms. Blackwood, she said, good evening. I'm really enjoying the discussion. Very informative. Yes. And remember, ladies and gentlemen, take notes because you're getting this for free. Take notes, all right? Sister Melonie, what you have to say about bouncing back from all this pandemic situation that people, it was new for everybody. Never see it coming. Ghost town.
Yeah, I mean, it was a pandemic. I mean, that's a word, but it's a word that has a huge impact. It took over the world, our entire world. This wasn't just a neighborhood, a state, a country. This affected the entire world, and it affected so many things, like mental, emotional, relationships, abuse, drug addiction,
church.
Jeez. But the question is, how do you bounce back? I know that for me, I was so grateful for my church, RCF, to continue to have services, even though we were doing it through Zoom and YouTube and different. I was so grateful because, when everything is lost, what do you have? And it's God. And having God in my life, my church, to be able to go to every Sunday, even if it was through Zoom, to check in, to listen to praise and worship, to hear a word, to see people who you are used to seeing in person, to see them on the screen, and my family.
Wow.
I am so grateful for my family to be able to, to talk to them, to see them, spend time with them. My immediate family and extended family and people who are not related to me, just people who I'm close to. Just that is how I got through, because nobody knew what was going to happen tomorrow. Nobody.
You watch the news, everybody, this is about 1,000 people that drop out. You come like you have some snapper, some mosquito snapper, just a snap people.
You had no idea what's going to happen tomorrow or the next week. And then it wasn't just that. It was everything was happening at the same time. That's part of the reason why they had the program Tell Your Story, because then the political things were happening. All of the racial, all of that stuff
and everything was happening at the same time.
At the same time, it was an explosion of so many different things, and in many ways later on, it opened up conversations, and a lot of things were exposed, and a lot of things. It was good, but then it was a lot. It was heavy. So for me, it's still a journey, but just God in my heart, praying. When I walked into my emergency room, they started prayer.
Wow.
At the beginning of the shifts.
Wow. Because you never know.
People were so scared. We were praying.
Wow.
I was praying with people I couldn't stand at my job, holding their hands.
Wow.
Because we were scared. And I don't know what they felt or knew, but I knew I needed Christ to literally walk me from room to room, to get me in my car, to drive home,
and
to
not
be
bring
with my
anything
babies,
back
to not
to your
bring,
family.
yeah, to be able to go to the supermarket,
Whoa.
continue doing things. Now I'm home teaching these kids at home. I don't know what I'm doing because I'm not a teacher.
Mentally
I don't have
stress.
Facebook. I don't know how to use.
Yeah.
And they
Yeah.
want you to. And I had to figure it out. And I am just so grateful to God because I know that if I didn't have Christ in my life, I would have lost it.
Amen.
Go ahead, sis.
Yes.
Go ahead.
That's
Go
just
ahead.
the truth.
And a lot of families found Christ
Yes.
through the pandemic.
Yes.
Because
They had to bond together.
they have to. There's no other way out. They're like, okay, what can you turn to? You can't turn to social media because all you see is how many numbers going up, but numbers ain't coming down.
Yeah.
And all you see is all these bodies they're bringing out, but none.
Yeah. And as Mel said, I started, so they knew, of course, my group knows that I'm a Christian. So let me tell you, not every day everybody wants to pray.
You're some pastor nominated.
And so we had our Zoom meeting, so they know, because I'm in the hospital, they know that at 7 o'clock my office door is closed because I'm going on Zoom. So now the whole door, everybody banging down the door.
One prayer. Listen.
Let me tell you, man. So who wasn't Catholic became Christian.
Oh, what I say, I Selassie them come turn to Jesus. Now tell you the struggles.
And when I would say, okay, we're going to pray, maybe say 10 o'clock, but something happened that I couldn't, I start getting page all over the place. Is it time to pray? Is it
time to pick up the Bible? Let's go.
Yeah, it was real that everybody bonded together to make sure that we pull through this.
This pandemic reminds me of giving birth to babies. So when you have enemies them and then you say pregnant, you know, everybody just want to see the baby. So them say baby pull people together.
Yeah.
This pandemic rip people apart but also pull together. So it have its pros and cons. But we as Christians, we should learn from this pandemic. Open up a lot of stuff that us as Christians wouldn't even know that we are so far apart from the man himself, which we call God. Because every day we get up, we go to church, we sing, and we come back home. But during that pandemic, we all evaluate ourselves like, what if that was my last praise? Would I make it? Would that last praise allow me to see his face?
True.
A lot of people, pastors, leaders, musicians, everyone, offering collectors, everybody evaluated themselves. And yet still, most of us, pandemic gone, we go back to the old ways, you know? Eh? If we don't wake up and see what's going on, ladies and gentlemen, this is a medical forum, but you know, when the spirit leads, you have to just talk.
Yeah.
And you know, these churches had the opportunity, still have the opportunity, went live, build their platform, but yet still joking around. But let's read this comment. Sister, it's Deuce. Okay, the number to call is 845-682-0652. So feel free to call in. Mr. Deuce, that's all right. Yes, so feel free to call in. All right, we're coming down nicely. At what age should a female should start having children? That one. And what happens after the age of 35?
Okay.
Sister Michele laughing.
So I'm just gonna address the fertility portion of it, because the question of saying what age should you have a child is a nuanced question. Everybody's mental, emotional, financial situation is different, and so the age that you should have a child will vary depending on your situation. Right. And some people have children. Some people have children when they weren't planning to have children, and you know, there's different situations. So the fertility aspect of it, your fertility, and we're speaking about women, I presume.
Yes.
Okay.
Boy, Sister Mel, I don't know if no man a give birth, man. Listen,
but you
should have
fertility.
children.
should have
The only way
children.
I can have a
Female.
child is by having a union with a man.
Yeah,
So
I
we need
love
each
that.
other.
You hear that?
It is impossible.
So I'm on you know what? Go ahead, sister.
So, once you start having a menstrual cycle, which can start for different people, it's usually between the ages of, I want to say, 9 to 13. Some girls are starting it at 8.
Huh?
Some can have it as late as even in their 16, 17. And that depends on a lot of different things, which we can get into.
Right.
But about the age of maybe like 9 to 13, when you start having your menstrual cycle, from that point on, you have the potential to become pregnant. Now, from your teenage years, let's just say 14, 15 till about your mid 20s, you are your most fertile. This is assuming that you are able to have a child or become pregnant, because you can get your period and not be able to become pregnant. There's a lot of different situations that cause people to be in that category.
Okay, so pause, just stick a pin right there. So I thought once you start seeing your menstrual, now you start developing eggs where at any time you can get pregnant.
But there's different medical conditions that could make it difficult for the embryo to plant into your uterus. People that have PCOS, endometriosis, there's different medical conditions, different thyroid issues, that hormonal issues that maybe you can get pregnant but you can't keep the pregnancy. There's a lot of different issues that can come into play. Trauma, surgery, cancers, there's a lot. So from about 14, 15 to your mid 20s, you're very, very fertile, and then your fertility actually starts to drop from your mid 20s.
Say what now?
Starts to drop from your mid 20s. Now you can still become pregnant, obviously, but the likelihood of becoming pregnancy starts to drop, and it starts to drop kind of slow, and then it starts to drop about 35. It significantly drops, and then above 40, it significantly drops.
Wow. So, females out there that's watching, I hope this open up your eyes and let you look at life different, whether you want to start or not. So,
let me ask you a question.
Yes.
Why did you ask what age should you have a child?
All right. So, there's a lot of, let me not say a lot, few of young people that I know that started out at a tender age and wasn't planned to get in that situation, and yet still the parent or the parents turn around and abandon such individuals. And I'm like, as a parent, you bring forth a child in this world and the child never follow exactly what you thought she would. Why would you abandon such individual? Because at the end of the day, the individual could have aborted
if they had the means.
But individuals chose to carry on, you know, and that's a big thing, because a lot of people that walk in cemetery. And this is why I ask at what age, because most individuals think that if you start at 16, 18, 20, 22, you give up on your life. You like your life done now. That's how they'll start look at it. Once you have a child at the age 20 and below, 16 and up, that means your career done. So this is why I like, you know, what is the age group where you think people have, us as Jamaicans, you know, you shouldn't have kids until you're married.
So yes, however, I could see why mom or dad would be upset, because who would want their daughter to have a child at 16?
Right.
1. 2 is not that your life is over, but do you see the struggles that you're going to be faced with now? Maybe the person that you're pregnant for is gone and abandoned you, so you're left with a child at 16. There's not a lot of research out there to prove that any 16-year-old that got pregnant had it easy. So to say it's A-OK, and I'm not saying you're saying it.
Right.
To say that getting pregnant at 16 is okay, it's not. But if it happens, we would hope that, you know, you turn yourself around and get back on track, because it's not going to be easy. And blessing to those parents who don't abandon you, because they're hurt. And I guess the parents who abandon the child, which is, I'm not going to tell you you're wrong or right, because hey, I'm not in that position to be judgmental. To be but I could see, because they're hurt, and so that's what they do, because, you know, me spend my money upon you, I'm send a guy to school, I'm going to do one better for you. And because me to get pregnant with you when me did 13,
thank you.
You come back and get pregnant at 16, and you don't know. So me get pregnant at 13, and you know come turn cruff at 16. Why you want me to do this?
Yeah.
So mom is hurt.
Yeah.
And I'm hoping, you know, sometimes along the line after the baby is born, sometimes mom change. There's a change. Sometimes. And that's a big sometimes.
That's a big one.
Big sometimes. Because then you're left, and you hear the stories of how hard I have it. I became homeless.
Yeah.
And I this and I that because I got pregnant. Yeah. And I couldn't finish my education, and I couldn't go back to school until I maybe was 24, whatever the case is. Because it's a tough road. It's a tough road.
There's a lot of shame.
Yeah.
I think it's embarrassment. I think that's part of the reason why parents and grandparents respond the way that they do to you know, young pregnancy, because that means you were having sex before you were married. That's the proof.
Yeah.
And now I have to explain to all of my friends, all of my church all of my sisters, that you, my child, are now pregnant and about to. So that's a part of that reaction too, is the shame.
True. Embarrassment.
Yeah.
Shame. I tell you why. But ladies, I know you're watching, ladies and gents, if you have friends and things in school, you have, you know, colleagues and stuff like that, don't succumb to peer pressure, because it is real, you know, especially being in high school. Everybody, if you're not doing this, that means you're not living life. And I have a boyfriend, and if you don't have a boyfriend, that means you're not in high school and you're not living the high school life. Everybody have to have them crush and them girl and them boyfriend, and everybody I look forward to go prom and them thing, and then after we Jamaicans, only most of us was privileged for have prom, because I never have none. Sister Melly did have prom. Oh, you see? Privileged Jamaica. Sister Michele, what about you?
I went to high school in Jamaica, so yes.
You had a prom?
Yeah.
I see. I never won.
Even enough I did prom with Carly, but we had
we have a something called banquet, you know, graduation, they come and have a little party.
Yes.
That's what we call it. But, you know, I know there's my cousin, Tanaya Mullins. What's the number to call in? The number is 845-682-0652, and that's my young cousin as well. Big up yourself, Tanaya. And remember, always have a head strong, especially in high school, because there's a lot of teaching, and not even high school itself, middle school too, because there's a lot of teaching that's dawning on most of our young people, and us as parents that are Christians. I would call ourselves Christians, you know, trying to be Christ-like. We have to be solid in our homes now, because sending out your kids to school and leaving in the hands of these so-called teachers, there are sometimes, you know, atheists and stuff, you know, other things that's happening in the school industry. We have to be strong and prove our kids them, because you think school was always the ground you can send the kids and then be safe. But right now the school is becoming one of cyberbullying and people commenting. This is where you find the mental issues. You think behind prison walls, schools have some mental stuff going on with these kids, and they're not talking about it, and their peers are bullying them on social media. So be careful, and as I said, parents, be aware and open spiritual eyes, and let's pray for our generation coming up, because them vipers are them wicked.
Yes, I think the vipers and the wicked has been around since the beginning of time.
But
There's
no
nothing new under the sun.
brawling.
I think it's just more obvious.
Yes, man.
It's more it's in the palm of your hand.
And especially since we have all this social media exposure. That's why we're noticing it more.
It's
Growing up, if you pass somebody and I say hello, how you doing, good evening, and the person know all their mother, just know so you go home and a different thing.
It's time.
Eh?
It's time.
Nowadays, them not look on them head down on them phone, them a walk across the road and if a upcoming vehicle, you know what I mean? Everybody's down on them phone, and this is the generation who don't want to call it AI, you know. Not, you know, only in the medical field, I leave to all them things. So, all right. So, last and final question. What are the worst cases you witness in the medical field that you have experienced with you, Sister Mel?
The worst cases of what exactly?
Trauma in the ER room, you know, somebody come one-legged, headless, headless.
Well, all right. There's ERs all over the place, but there's different levels of care that ERs provide, and the one that I happen to work at is called a level 1 trauma center. It's actually also a designated stroke center. We do lung transplant, liver transplant, kidney, heart transplant. We are designated stroke center, meaning that sometimes your local ER or a community hospital can see you having the stroke and can take you in and do the initial treatment, but they would have to then transfer you to a higher level of care, as Sister Michele had mentioned before. So the ER that I work in sees a lot of different types of patients, and pediatric. I also take care of newborns and so the craziest thing where do I start? I mean, I see the basic things like people having heart attacks and strokes. People fall, bone breaking. I've seen people give birth in the ER. People have gotten shot. People commit suicide. We handle psychiatric patients, so people who are really having difficulty managing their psychiatric whatever they're having and trying to manage that. Everything, infections, stuff going on, cancer.
So you see before, a handful.
People placing items in orifices that are not supposed to place.
God go with you.
Okay. And have a whole story that comes along with it.
We bring it back on for that.
Child abuse. Rape.
Stick up in there, you know. See, this is why in here there's a lot, because this you can keep going on and on and on, because every day something new and you learn every day. Wow. Lift my cap to you, I tell her. Sister Michele, what about you? What in your form of experiences, what's the worst you have ever experienced being in a medical facility?
Well, being called because maybe a child, I would say the worst, have worked in 2 level 1 trauma hospitals. And if I'm covering as a AOD, being called because there's a child that was dipped in burn, just lift up, dipped in pot of hot water.
Oh my goodness.
And so we got a call as the AOD, so we got to make all these phone calls. Abuse, mostly abuse cases that are coming in because we're, you know, and if there's any
don't hurt yourself. Don't stress about
You're
it.
You're just bringing me back to cases
it's okay. Alright, we ain't gonna touch on it for now, but you know, these are ladies and they have their experiences, and some of them are, you know, very, very touchy. But you know, as I said, this is their first time. Well, Sister Michele's first time, won't be the last time. But you know, before we close this forum, what would you say, Sister Michele, to everyone that's watching, that, you know, we've been going through all these questions and stuff like that, and it's been related to stuff that people can learn from and not to be scared of. What would your words be to encourage someone out there tonight?
My final words would be to someone, of course I'm going to base it on mental health. If you yourself are in a crisis, please seek help. I know that there is a stigma associated with mental illness, but it is real, and your story is unique. Your story, the story of your family, the story of your loved one is unique. So if you yourself or a family member or someone close to you needs help, please seek help, because it is a unique story to you.
Yes. Take heed, Sister Mel.
Oh, final words. You know, it's important to be spiritually strong and connected to God, because that's your rock. That is your rock. And as Sister Michele said, there is a stigma, but you know, having mental health issues is real. It affects everyone. It doesn't matter where you come from. And don't ignore it, you know, and seek help from professionals, not from, you know, just be careful of your sources.
Right.
And just keep positivity around you, you know, your circle, people who you speak with and interact with regularly, keep them positive.
Right. All right, there you have it, ladies and gentlemen. My final words is, whatever life throws at you, sometimes it is difficult, but there's always hope, and there's always someone there to lend a helping hand. Pride is something, is almost like a disease. It's a silent killer, I would call it. So a lot of us as men, we are built on pride, but you see, once you can take that out of the picture and you can call a spade and say, listen, I'm not well in this field, and you know somebody that is equipped like these ladies here can go to and talk to. Say, I call you know Sister Michele. God help you, come see up on Sunday, Sister Michele. you know. But ladies and gentlemen, don't be scared, as Sister Melonie said. Always reach out for help. It's never too late. Once you have life, all things are possible. There's hope. So please be encouraged and pray for these ladies, as what Brother Richard would say. Pray for these ladies in the medical field, because whatever they're facing is not easy. We outside not seeing what's going on inside. We have family members and stuff like that. So pray for them. Keep them up in your prayers, and remember, with God, all things are possible. Alright, so this forum is coming to you straight off out of JNA Studio here in Mount Vernon. Our CEO, Mr. Minister Morrison, you can catch him on Monday nights on Real Talk Gospel Radio. And remember, if you haven't subscribed to my channel as yet, my channel is RODZ776. Go on over and share up the link. And remember, if you have anybody out there who would like to hear this forum, share the link. Alright, share the link. And remember, stay true to the cause, and once there's life, there's hope. Ladies, thank you so much for joining me. I'm humble enough to say thank you for coming here tonight. Yes, man, I tell her, as I would say, legend amongst legends, you know, and I'm grateful to be amongst you ladies tonight. It's an honor. So thanks again for showing up. You could have otherwise, but in the meantime, DJ, take it away.